Hello, you are welcome to class. My name is Dr. Isagboyin Henry. We are continuing our series on human nutrition and we are discussing lesson note 47, Process and Principles of Dietary Counselling. Process and Principles of Dietary Counselling. So let's dive into the discussion proper. Okay, now let's begin by dietary counseling. When you say dietary counseling, it's a structured process aimed at helping individuals make informed choices about their diet. Now, ultimately, it promotes healthy eating habits and improves overall health. Now, the process is based on sound nutritional principles involving communication, education, and personalized advice. Now, let's see introduction to dietary counseling. The dietary counseling involves providing guidance and support to individuals or groups to help them make healthier food choices. It is a collaborative process that requires both the nutritionist expertise and the active participation of the client. So the two of them will need to work together collaboratively if they want a good result. It can be utilized in various settings such as the healthcare institutions, community centers, and public health programs. Now, effective dietary counseling will help in the prevention and management of many chronic conditions like obesity, diabetes, and cardiovascular diseases. Let's look at the key principles of dietary counseling. There are key principles of dietary counseling. Now, the success of dietary counseling likely depends on adhering to several key principles. Now, you have the client-centered approach, you have the active listening, and then you have the non-judgmental attitude. If you want a successful dietary counseling, it must be client-centered approach. You apply empathy and respect. You also have to listen actively to the client, and then do not be judgmental. Do not have a judgmental attitude when dealing with a client. Now let's look at that of the personalization. Personalization now. Dietary recommendations should be tailored to the client's specific health needs, the client's preferences and cultural beliefs, and socioeconomic status. And so there should be the individualized goals. You set realistic and achievable dietary goals that align with client's lifestyle and preferences. You also consider the educational level. Clients should be educated about the nutritional value of foods. You make sure that they are well educated. The importance of a balanced diet is part of the education, and how food choices impact health should be part of the education. Therefore, providing information in simple terms using visual aids like food models or pyramids and giving them examples can enhance their understanding. Let's look at the other principal key areas. Behavioral change. The focus is on helping the client adopt long-term healthy eating habits rather than a quick fix solutions 1 week or 2 weeks. No, it's a long term. Now, counseling should include strategies for behavior change, such as setting small incremental goals and gradually introducing new foods or eating habits. You also must consider cultural sensitivity. It is important to acknowledge and respect cultural dietary patterns and preferences. So in this case, you are tailoring your advice to include foods that are culturally acceptable and can increase the likelihood of success. So take note of this, very important. And also, number 3, we want to see the steps in dietary counseling process. What are the steps? You want to carry out a successful dietary counseling process. What are the steps? Number 1, you need to carry out assessments. The first step involves assessing the client's current dietary habits. You need to know the health status and the lifestyle. And this includes a detailed review of how this client eats, the pattern, medical history of the client, the physical activity levels, and any existing health conditions that you need to know. Now, methods such as food diaries, dietary recalls, and nutrient analysis tools can be used to gather this information in as much as you're able to gather as much as possible so that they don't forget. The next is that you carry out a diagnosis. Based on the assessments, the counselor can identify any nutritional deficiencies excesses, or health risk. Example, hypertension, obesity, and diabetes. Now, this diagnosis will help in setting clear, achievable goals for dietary improvements. Now, let's talk about goal setting. Establish specific, measurable, achievable, realistic, and time-bound SMART goals. It is specific, it is measurable, it is achievable, realistic, and time-bound. Not a kind of goal that, in fact, it is up there and may never get there. For example, reduce daily milk of added sugar by 20% within 1 month. That's how you do it. You don't say, don't take it at all henceforth. That will be difficult, but a gradual reduction by percentage within 1 month. So what interventions do we need? Interventions. Because after assessment, you carry out diagnosis, you now make your goal setting, then interventions begins. And now this step provides or involves providing the client with practical dietary recommendations that may include recommending healthy alternatives to unhealthy foods that he or she has been taking, suggesting portion control techniques, so that, and you do this in an educative manner, so that you will know the difference between, former portion control, portion that he takes and the new portion control techniques. Also offering meal planning advice to ensure balanced nutrition and providing educational materials such like brochures or giving websites, links and food guides so that he can go and do further studies. Then the next one, you do a follow-up and you monitor. After the patient is gone, you do a follow-up. The patient is to visit you. You have sessions with these patients, and then these sessions are crucial so that you can track the progress of these clients or patients. Now, provide additional support to them and make any necessary adjustment to the diet plan when the need occurs. Maybe the person is reacting or is beginning to, have some impacts negatively. You have to readjust. Now, monitoring involves assessing both short-term outcomes, example, weight loss, blood sugar levels, and also long-term behavior changes, example, adherence to dietary changes. Now, this is very, very important. Remember again, in terms of the steps in dietary counseling, assessment number 1, diagnosis number 2, goal setting number 3, and intervention number 4, and finally follow-up and monitoring. Now let's look at the 4th aspect, techniques and tools used in dietary counseling. Number 1, use the food diaries, where a record of everything the client eats and drinks over a specified period is recorded. Number 2, use the 24-hour recall. Clients recall all the food and beverages they consumed in the last 24 hours. Then you also use your FFQ, that's the food frequency questionnaires. Use it to assess the patient to know the frequency and portion of sizes of specific foods that they have consumed over time. Then you also use the motivational interviewing. Here, a client-centered, goal-oriented method is used. It will help the client resolve, ambivalence and make positive dietary changes through empathetic communication. Now, when in this case, you motivate the client so that the client is so happy, so he feels so involved, because it's a discussion and it opens up everything, even what he shouldn't have wanted to say, such like taking Indian hemp or taking cocaine and so on. Now you have cognitive behavioral therapy also. You can use that. This can be used to address psychological barriers to healthy eating, such as emotional eating or unhealthy food association. You also have nutritional educational materials. You give them. They include visual aids such as the food guide pyramid. For one of them is called My Plate, or handouts that help clients understand their nutritional needs and how to achieve them. They go back home, they read, they look at the website, and they're able to understand more in addition to what you have taught them. Now let's look at the 5th aspect, challenges in dietary counseling. Challenges in dietary counseling. Now the first one is client resistance. Sorry about that. Look at it there. Challenges in dietary counseling. The first one is client resistance. Clients may be resistant to change due to, the ingrained eating habits or the lack of motivation. But counselors must be patient. You have to be very patient. You have to be encouraging. You help those clients overcome their barriers and they fit in, and then they have confidence in themselves. Number 2 is the lack of time and resources. Lack of time, and in some settings, time constraints or limited resources may impact the effectiveness of dietary counseling. Strategies need to be practical and easy to implement within the client's lifestyle. You also have the cultural and socioeconomic barriers. Cultural and socio-economic barriers. Cultural dietary preferences or limited access to healthy foods can pose challenges. Counselors must be creative in recommending feasible changes based on what is available and acceptable to the clients. Cultural dietary preferences or limited access to healthy foods can pose challenges. Counselors must be creative in recommending feasible changes, based on what is available and acceptable to the client. Having known this, let's see the conclusion. Dietary counseling is an essential aspect of promoting public health, preventing chronic diseases, and it requires a personalized, empathetic, and informed approach that incorporates the client's individual needs, preferences, and cultural background. You see, through this continuous support and education and appropriate interventions, individuals can make sustainable changes that will improve their health outcomes. You have a role to play, very importantly. The clients have a role to play, very importantly, and you collaborate together to play your role successfully. With this, we have come to the end of this aspect, and I am requesting that you should please ask your questions on the platform as much as possible, and remember also that you can read read up using your textbooks, and also make your summary. I'll be there in the class to make expansion and more discussion on this. I'll see you in the next class. Have a nice day. Bye.